Everyone feels anxious now and then, whether it's a problem at work, before taking a test, or making an important decision. Anxiety disorders, however, interfere with people's ability to lead a normal life and can be disabling. Anxiety disorder affects 40 million adults in the United States, according to the National Institute of Mental Health. Dr. James Meyers at Pomona Valley Hospital Medical Center describes anxiety and anxiety disorders.
Anxiety is something that we all experience at one point. It can be a normal reaction to stress. For example, if you're going on a hike and all of a sudden you came across a bear, maybe she had a cub and she could be more aggressive, and maybe she turned around and looked at you right in the eyes, and then yes, your heart starts beating, then maybe your muscles start tightening up a little bit, breathing starts to get a little bit faster, and that's kind of normal and expected. But now imagine you're having these symptoms on an everyday basis, maybe with your regular routine. And this can really inhibit your function and your ability to be happy in life. And this is when we start to suspect more of an anxiety disorder.
Dr. Meyers discusses different types of anxiety.
Social anxiety, OCD or obsessive compulsive disorder, panic disorders. The one that I see most, and I think most doctors see a lot, is what we call generalized anxiety disorder. And that is kind of more excessive worry with more everyday routine things you do. And the symptoms, you could have restlessness, easily fatigued, you could get muscle tension, trouble sleeping, more irritable. And when you have these symptoms along with this excessive worry, and when it starts inhibiting your functions at work, performance, family relationships, friend relationships, this is when we say that the patient might have generalized anxiety disorder.
Many conditions can cause anxiety symptoms.
There can be other diseases, other disorders that can mimic anxiety, thyroid disorders, electrolytes with calcium imbalance. There can be side effects from medications maybe you're already taking that could cause these symptoms, obstructive sleep apnea, heart disorders. So those need to be kind of addressed first to make sure it's not something else besides anxiety. Substance abuse is another possible cause, alcohol.
Treatment options range from physical activity to medications.
It usually takes a combination of methods to help treat anxiety. I like to start off with the more natural, non-medicine treatments first that are available. The first one being physical activity. Physical activity has been shown in studies to help with the symptoms. And as little as 3 times a week, about 20 minutes a day, has actually been shown to help. Yoga has actually been shown to help manage symptoms. Cell phones, they have nice good apps that you can download that can help with that, and relaxation techniques. And if those things aren't helping, there's also talk therapy, or with a therapist or with a psychologist or your psychiatrist, where they can sit down with you and organize your thoughts and participate in what's called cognitive behavioral therapy. If you've tried the non-medicines, the physical activity, those things aren't helping, there are medicines that have been shown to help as well. The first-line treatments are in a category called SSRIs. These are your Prozac, your Zoloft. Those are some of the more familiar ones. These also help with depression too, and depression and anxiety often go hand in hand.
There still needs to be progress towards treating mental illnesses like other conditions.
There's a lot of stigma associated with mental health disorders, anxiety and depression, and so a lot of times it's kind of pushed to the side and not really want to be addressed because it can take more time, which health systems don't allow for that, and so it is tricky when you're trying to manage anxiety.
These options have allowed people to manage their anxiety and get back to a fulfilling life.
Some of the symptoms that I discussed can lead to physical problems, pain, a lot of emotional distress, and like we said, your ability to be happy.